Hello everyone, I'm Kibin Alleyne and today is Tuesday, July 30th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. The NYU Rory Meyers College of Nursing received a $5 million grant to strengthen the workforce caring for older adults in the Bronx. The federally funded initiative aims to assist and train 5,000 health professionals and nursing assistants. Dr. Cortes of NYU Rory Meyers College of Nursing, Dr. Ehrlich of Montefiore Health System and Albert Einstein College of Medicine, and Paola Ogando of JASA join me to discuss this collaborative effort. I want to thank you all so much for joining me to discuss this.
Thank you for having us. Thank you.
Now, through NYU, Dr. Cortes, you are leading the effort toward an initiative that will train 5,000 health professionals. Can you tell me more about this effort and why it's needed?
I'm happy to, and thank you so much for having us here today. This really builds so nicely on the work of the Hartford Institute for Geriatric Nursing, also known as HIGN at NYU Rory Meyers College of Nursing, because our work at HIGN really is to educate the workforce, educate legislators, educate the community on the unique care of older adults to promote better aging, healthier aging, and quality health care. So we are so excited about this opportunity to educate 5,000 healthcare providers across the Bronx. We will be educating physicians, nurses, social workers, pharmacists, occupational therapists, physical therapists, certified nursing assistants, community health workers, just to name a few. Anyone who touches an older adult in the community is going to get some education. We are focused also where we think the most important care is given for older adults, and that is not in the hospital. It is in the community, whether they be living in their home, whether they be living in a skilled nursing facility or in assisted living. They require health care, and the kind of health care they get is so important to maintaining healthy aging and keeping them at their highest level of potential. It's needed because in healthcare profession training and education, people learn how to care for adults. Caring for an 80-year-old or a 70-year-old is not like caring for a 30 or 40-year-old. It's a very different kind of care. It's important that people are educated and trained to understand the uniqueness of that kind of care.
Thank you so much for sharing that. Now, Dr. Ehrlich, what is Montefiore's role in this, and how did the partnership with everyone kind of begin?
First, thanks for having us. It's so wonderful to be here with the three of us, to have a social worker, a nurse, and a physician together partnering on this grant, because that's what it takes to care for older adults. It requires a team. So let me just tell you who I am. So I'm the Chief of Geriatrics at Montefiore and Albert Einstein College of Medicine. But what is geriatrics? So I'm a geriatrician. So I had specialized training. I'm a physician, a regular internal medicine, specialized training in the care of older adults. So geriatricians focus on the common conditions and syndromes that face older adults as they age. For example, falls. Up to a third of community dwelling older adults fall every year, and they have falls with injury. So how do you prevent falls? How do you take care of somebody who falls? And what about patients with dementia? Did you know that the Bronx is one of 3 highest prevalence of Alzheimer's disease in the country, along with Dade County and one of the other counties in Maryland? So we have specialized programs. How do you screen people for dementia? How do you then treat them? And how do you care not for just the person, but their caregivers is such an important part of what we do. So part of what we're doing as geriatricians is we have to train other health professionals in the care of older adults and spread the knowledge that we have for the whole team so we can efficiently and sensitively, with kind of patient-oriented care, take care of our frail older adults.
Thank you. Now, Paola, thank you so much for being here once again. Can you just talk about, some of the challenges, just older adults face, and especially in a severely underserved borough like the Bronx?
Thank you, Kevin. Thank you for having me. I want to start by saying, and I would like to introduce myself. I am Paola Ogando, a program director of JASA Health Services, and JASA is the leading social service agency in New York City, serving more than 40,000 older adults aging in place. with all different sorts of services, and I will get into that in a second. But I do see the challenges that our older adults are facing in our underserved boroughs, and that is lack of knowledge. Lack of knowledge that there are services available for them. A lot of our older adults don't have or have limited support from family members or from a care partner who can kind of guide them in the services that are available for them and that they're entitled to. And as well, a lot of them are homebound. They're not able to necessarily get out there to find out the services that are available to them. And that's why I'm so proud to work for an organization like JASA, who has been serving older adults for over 50 years now. Over 40,000 in New York City. And one of the many services that we have is affordable housing, older adult centers, mental health services for older adults as well. We also have APS, Adult Protective Services, elder abuse education, and access to older adult centers in the community. So,
thank you so much for sharing a little bit more about your organization. Now,
you.
I definitely want to talk about, age-friendly care, the term, basically, Dr. Cortes, can you tell us a little bit more about the term age-friendly care and why it's important to recognize this in health?
Age-friendly care became a concept about 6 years ago, and it's kind of spreading across the country. We see it more. There's 1,500 hospitals across the United States that are designated as age-friendly hospitals. The concept of age-friendly grew out of research, evidence that pointed to the fact that there are probably 4 factors that most influence the care, quality care, and healthy outcomes for older adults. And I'm going to go into each one of them, but it's what matters: medication, mentation, and mobility. So what matters? What matters to the older adult? What is the most important thing to them? We used to have provider-centric care where it was up to the doctor or the nurse or the social worker to tell you what was the best for you. It's really the person who should determine what matters to me. I might think that there's a medication that is the best medication for you to be taking because of your disease. You may say, I really don't want to take that because it's going to make me very sleepy, it's going to make me lethargic, I'm not going to want to get up and do things. That's your right. So it's what really matters. What quality of life do they want? The second one, medications. We really do over-medicate our older adults. We've seen people who have gone from 14 medications a day down to 2 with very good, thoughtful physician and nurse practitioner thinking of how do we narrow this down? What do they really need to be on, and is there duplication? So over-medication is a problem, and that needs to be taken into consideration. Mobility, as Dr. Ehrlich mentioned, falls is very important. If you have a person who falls, their chances of having disability or moving into a nursing home increases. So make sure that they are mobile, and if they're not, give them what they need. And the final one, mentation, the 4 M's, the final one, mentation, is all about depression, dementia, and delirium. Depression is very common in older adults and the most unrecognized condition. So it needs to be screened for. And we do know that approximately 1 out of 2 people over the age of 85 do have some sort of dementia. So they need to be screened, they need to be cared for appropriately. And delirium often occurs in older adults when they have an infection or some process going on that's not normal. So that's what age-friendly healthcare is all about.
Thank you so much for explaining that and clarifying and kind of talking about what we need to do better, for our community of older adults. So thank you so much for that. Dr. Ehrlich, I'd really love to hear from you, basically talking about the Bronx and how it lacks healthcare resources. How will this $5 million toward the program address shortages of healthcare professionals specializing in the care of older adults?
Great question. So there's not just a shortage of geriatricians, which are physicians taking care of older adults. There's a shortage of nurses. There's a shortage of social workers. There's a shortage of home health care workers. So our goal is to have everyone learn something about older adults based around the 4 M's that you heard about. So for example, every older adult should be screened for cognitive impairment, for dementia. And then if you identify it, you then have to take care of the patient and their caregiver. For example, they may be entitled to services from JASA that they don't know about. They may be entitled to have Meals on Wheels. They may We have people who have significant cognitive impairment wear wandering bracelets so that if they wander, somebody can identify them. They may be entitled, may be eligible for additional entitlements. So, and the caregivers are so stressed taking care of these older adults. So we want to then take care of the caregivers, have them have caregiver support groups and other services. So we want to train train the doctors in the community to screen for dementia and then refer them appropriately. But we're also training the healthcare workers. So Montefiore Health System has the Healthcare Worker Institute, which is a large, really innovative training program for healthcare workers where it employs workers from within the Bronx and then trains them. So we want that institute to include a curriculum in older adults. So our JASA social workers are going to be partnering with both nursing and physicians to train the community health workers on caring for older adults. So we're going across the board training everybody on how to care.
That's amazing. And then kind of expanding on that, Paola, can you just let us know what role, do community-based organizations play in supporting older adults in the Bronx, and how does this initiative build upon that?
Oh yes, for sure. Community-based organizations are super important and are a vital part of our older adults' life, especially an organization such as JASA. So for example, JASA can definitely guide an older adult person to realizing the services that are available to them, that they're entitled to, and that can help them age in place, at home, in their community, with dignity and autonomy. And it makes me really excited to have this partnership that goes hand in hand, because we will be able to continue to train healthcare professionals in the age-friendly care that we have been practicing for quite a while now, even further. And I think it's going to be the perfect match to have that social service aspect and that healthcare aspect come together. And the work that I have been doing in the partnership that the Center for the Aging Brain at Montefiore has with JASA, as their lead social worker, I have been witnessing being part of an interdisciplinary team that guides our older adults and their care partners in the services that they're entitled to and the care that they so deserve.
Thank you so much for that. I just want to say also, it's so lovely to see, different just pillars, of health kind of come together and support our older adults. So I definitely want to mention that. Now, Dr. Cortes, can you just let everybody know where they can go to find more information about this program? And if they have an older adult in their life that they want to kind of be a part of this, what can they do?
We will have a web page. It will be on the HIGN.org website on the GWEP program, and all of the resources available under the GWEP program will be there. I think what we've seen here today is the perfect exhibit of caring for older adults as a team sport. And it takes all of us together and to come together and really provide the kind of care that keeps people healthy, living at home, where they can have the best quality of life.
Well, I want to thank you all so much once again for joining us and having this really important conversation.
Thank you for having us. Thank you.
To learn more about the Geriatrics Workforce Enhancement Program, please go to the website on the screen below. Don't go away. We'll be back with more Open after this.